Micropigmentation after hair transplant? Hello. I want to know, please, if it's okay to make micropigmentation about 2 months after hair transplant. Also in the area of the transplant. Thank you.
Thank you for your question. You're asking if it's okay to have micropigmentation performed 2 months after a hair transplant, and you submitted a photo. It appears to be almost immediately after the transplant was performed, showing the distribution of the grafts, and it certainly looks very, very good. And you want to know if you can also do micropigmentation in the area of the transplant. Well, I can certainly share with you my perspective. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. Hair transplant has been a significant part of my practice for over 20 years practicing in Manhattan and Long Island. I'm also the founder of Tricostem Hair Regeneration Centers, which is a non-surgical treatment for hair loss developed from our hair transplant procedures to help people with male and female pattern hair loss using a wound healing technology we developed. So certainly I can give you my perspective and how we came to developing hair regeneration and why my recommendation will be as follows. So when you think about hair transplant, it is a graft. In other words, you're taking hair that is attached to skin and moving it from the back of the scalp all the way to the front of the scalp wherever you want to fill it. And in your situation, it was placed along the frontal hairline. Now, I'm sure what you were concerned about is developing a certain density or appearance of density in order to blend in with your existing hair area. However, what concerns me is that you have to allow the hairs to actually grow. The 2-month period after a transplant is a period where there is going to be some shock loss of your grafts. There may be some grafts that will stop growing and you won't see the actual hair shaft. You will wonder as the next couple of months go on whether or not your grafts are taking. It's part of the normal process of healing. It takes at least a year to appreciate the full growth of the grafts. Now, that being said, it means that it takes a year to see which grafts took and which didn't, and where micropigmentation would be of potential benefit. But most concerning really is the potential trauma. To understand micropigmentation, you basically have to think of tattooing. Tattooing is the application of an ink into the deeper part of the skin called the dermis. So in order to deliver that ink, you have to use needles. Well, if you could imagine those needles passing into the existing hair or into the area of the grafts, even if it's set to a more superficial level, there's potential for trauma and potential for loss of grafts. So I would definitely advise against micropigmentation in those areas. If you want to do micropigmentation in areas where no graft procedure was done, certainly that's probably acceptable. But I think you need to allow yourself the full healing. When we developed hair regeneration, we were actually using a wound healing material to help maximize the growth of hair grafts and as well as to treat hair that was thinning to help it grow thicker. At this point, we're actually using hair regeneration independently without surgery to help people with thinning hair, so they can actually non-surgically get coverage that is comparable to a hair transplant. Of course, we still do hair transplant in a situation like your own where there's a frontal area that doesn't have hair, and if you want hair in that area, hair regeneration can help the grafts heal and possibly stimulate growth in the existing area, but hair graft is appropriate. But that being said, understand that it took a lot of work to put those grafts in. give yourself the opportunity to let those hair grafts grow. Wait, be patient, wait this out until the grafts have fully developed and grown. And I'm sure if you ask your surgeon would agree. So in the meantime, just be patient. If you want to try to blend, sometimes the use of topical fibers can be of value. But again, this is something that you should discuss with your operating surgeon. So I hope that was helpful. I wish you the best of luck. And thank you for your question.